Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare.
Well, today we're going to talk about iodine, the missing mineral in Indiana.
Very good.
So, Dr. Prather, why is iodine missing in Indiana?
Well, yeah, there's a couple of ways that you can get iodine. The sea is the best source of iodine.
Well, we don't have the sea.
We don't have the sea. Matter of fact, if you're close to the sea, you actually even absorb it through your skin, and you breathe it in. So also the mist from the ocean lays down iodine in the soil. So in the on the coast, wherever you're close to the ocean, salt water, then you get a lot of iodine.
Well, I know I was just in Charleston, South Carolina, and I felt wonderful.
Right, because you're getting quite a bit of iodine at that point. The other thing is you can get it from the soil, and different parts that are in the the rest of the United States. There was a time where they were under the ocean, and so when they were under the ocean, they absorbed a lot of iodine, so you can have it in the soil. Now, in the Midwest, the Great Lakes area, which Indiana is a part of, we were not underneath the ocean. So we don't
We're
have...
We're a foot above.
Yeah, we don't have iodine in this area. Matter of fact, the lowest concentration of iodine is actually in Wisconsin. So what that caused an awful lot of problems. And so naturally, we don't get a whole lot of iodine either from the soil or from the ocean.
So we could have said iodine, the missing mineral in the Midwest.
It's actually in the Midwest, because you're talking about Michigan, Wisconsin, Illinois, Indiana, Ohio, is sort of that whole area in through there that's missing the whole iodine.
Yeah, and let's talk about why is that important? Why is iodine so important?
Well, what they used to do is call it the Goiter Belt.
That sounds wonderful.
Oh, isn't that a wonderful
Take
term?
Hoosier over.
Put that on the advertising to move here, right? Come to the Goiter Belt. So it was a real problem, because what would happen is iodine is essential to make the thyroid hormones. So if the body wasn't able to make enough of that, what it did is it stimulated growth of the thyroid. So the thyroid would enlarge, and then you would have this big goiter on your neck, where there was an enlargement of the thyroid, because the body was trying to get the thyroid to produce more, so it was enlarging the thyroid so it could. And we just had a real bad cycle there, where people would develop goiters on their neck, and it was a very common type of thing, where people had enlarged thyroids here in the Midwest.
So you could physically see it.
You could physically see it. Now, one of the things is that when I'm doing examinations on patients, I'm always checking their thyroid, palpating the thyroid. And an enlarged thyroid is a very common thing that I find, even now on our patients. So, it doesn't have to be really visible. You shouldn't be able to palpate the thyroid if it's functioning normally. If it isn't, then we've got a problem. And one of the things we look for is iodine deficiency.
And I know you can sometimes see it, right?
Oh, very oftentimes. I can actually see people walk into the office, and as I'm just looking at them, I can see their thyroid. Now, in the older days, it was you see pictures of people with goiters, or if you actually see someone with a goiter, it's very evident of visibly of seeing that. We don't see it like it used to be.
Well, what are the symptoms of low thyroid?
Are you ready?
Lots of them, huh?
This will take a little bit of time. Fatigue, apathy, depression, irritability, weight gain, aches and pain, sensitivity to cold and heat, constipation, menstrual issues, recurring infections, high cholesterol, hair loss, dry skin and hair, brittle peeling nails, infertility, insomnia, anxiety, panic attacks, poor memory and concentration, low libido, headaches, premenstrual syndrome, lowered immunity, carpal tunnel syndrome, Raynaud's phenomenon, water retention, dry eyes, blurred vision, eyebrows loss on the outer one-third, anemia,
That's interesting.
slow healing, hoarse voice, tingling hands and feet.
What's a hoarse voice?
When you... it sounds
horse.
like horse.
I'm thinking the animal horse.
So it causes a tremendous amount of symptoms.
That was interesting. It said apathy.
Apathy, yes. The main thing that, iodine goes to quite a few different types of areas, but in itself, you're really talking about a lot of neurological development. Matter of fact, iodine can really determine the intelligence. One of the things is that when you have a goiter, you seem kind of really apathetic. You can't really get yourself to do anything. You feel very, very tired, and it's very hard to think. That foggy brain thinking type of thing. An awful lot of that is just physiology. Many people just sit there and say, I don't know what's wrong with me. And oftentimes it's their physiology. And once we get their physiology corrected, it's amazing the personality that comes out.
Yeah, that's so important. And, with the mental health issues, really checking your physiology, getting good blood work also. Because
physiology is the controller of how we think, our emotions, personality, all those types of things are really so much dependent upon our physiology that people don't really realize it.
Interesting. So how is the thyroid best checked?
The thyroid is checked, and iodine is also checked with blood tests. And one of the things that is a very common thing that occurs is that doctors check your thyroid, and they'll sit there and just check the TSH and say, oh, you're fine. It's not high. But the thyroid is much more involved than that. Matter of fact, we have about 35 blood tests for that. And one of the most important ones is the iodine levels. Because even if your thyroid levels are normal, if your iodine is low, then you don't have a properly functioning thyroid hormones.
Well, I know in our extensive blood work, iodine is included.
Iodine is included, especially here in Indiana. You need to include that because otherwise you're missing a very big factor along those lines. People have been said, hey, your thyroid's fine. We recheck it and then also do much further blood tests, especially the iodine. And once we get all those things balanced out, all of those symptoms that are coming from the low thyroid go away.
And you're talking about sometimes people come in and say, well, I was told my thyroid is fine, but they're just checking.
They're not really being thorough.
Okay.
On the thyroid blood work, and you're not really checking the thyroid completely if you're not doing the iodine test too.
Iodine.
Right. Otherwise, if your iodine's low, it doesn't matter what the thyroid levels on the hormones say, because it's not going to be an active thyroid hormones.
So very important, the iodine.
Very,
and
very
that's
important.
included in the Prather profile.
That is.
Well, what is the percentage of people whose thyroid checks out normal?
Well, interestingly, in our office, as I have people coming through, it's only about 5%.
That have a normal thyroid.
Have a normal functioning thyroid.
Wow, 5%.
Right. Now, that's according not to disease care model, but according to the homeostasis. What we deal with structure function. So once we can get people's thyroids actually normalized, it's amazing how many of those symptoms go away. And it really has a very, very specific numbers is what is ideal. And it's ideal in everyone. And one of the things that I've done is being able to educate the medical doctor and the nurse practitioners who come into our office, because they're like, well, the thyroid's normal. And I say, no, it's not. So, I have to show them on that, as we start to get them trained, show them how important that is to get those thyroid numbers exactly where they need to be. And then all of a sudden people say their symptoms go away. Blood tests, one of the things that has been done by quite a few people who do structure function care is ignore the blood tests. They're not really accurate. No, the blood tests are completely accurate.
Yeah, how could a blood test not be accurate?
Well, what they were doing is they were being reported that the thyroid's normal, but they could see that the symptoms were still there. Mm-hmm. That all the signs and symptoms, and so they would treat the thyroid, and all of a sudden those signs and symptoms would go away, and the person felt much better. So their conclusion was that the blood levels weren't accurate. Now, that's absolutely not true. Mm-hmm. It's just that they weren't doing thorough blood tests, and they weren't reading them for their exact numbers that they need to be. We can tell exactly when we get the numbers absolutely perfect that the person's going to get better. Mm-hmm. So the blood work is extremely accurate. It's just that they weren't being specific enough.
Okay.
And thorough enough.
Yeah, beyond those normal ranges.
Well, beyond, what they considered were normal ranges, which aren't true.
Mm-hmm. Okay, when we come back, more on iodine, the missing mineral in the Midwest.
You can win a free 60-minute massage in a relaxing spa at the Prather practice. Each month we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather practice.
How about vitamin A's role in gut health? Gut health is so important. You talk about how healthy our gut is, how healthy we are.
So every major disease that is in the gut is always helped by vitamin A, because vitamin A, just like with the lungs, immunoglobulin A is the major immune system through the gut. So it really helps to get your immune system up. But then also vitamin A is absolutely critical for the lining of the gut, small intestine, large intestine. And so if that starts to break down, then you start to get the whole breakdown of the whole tissue. And then you start to get the food allergies that start to occur. And that's why that's associated with the bumps on the back of the arm. So the bumps on the back of the arm are two things that means, is that you have food allergies and probably kicked off by low vitamin A. People have heard about the leaky gut. You cannot fix a leaky gut without getting the vitamin A levels back up to par. Mm-hmm. So, that is a very critical part. If you have Crohn's disease, ulcerative colitis, IBS, diarrhea, constipation, cystic fibrosis, any of those types of things, you're going to have to work with the vitamin A. Mm-hmm. Now, once you develop those diseases, your absorption of vitamin A goes way down. So it becomes, if you have any of the different types of diseases in the gut, if the gut's not working right, then you can't absorb the vitamin A as well. Mm-hmm. So you can see where that can become a vicious cycle and really start to wear down the whole system. Now, it doesn't just end there, but you also have to have the bile in the gut to be able to absorb the fat soluble vitamins into your system. So let's say you've had your gallbladder taken out. Well, guess what? You're going to be deficient on vitamin A. And that's going to start to create a whole cycle in your system of actually wearing you down. So anyone who doesn't have a gallbladder is going to have to take supplementation the rest of their life to be able to absorb their vitamins.
A lot of people don't.
I know.
They think their problem's been solved.
Right.
Take the gallbladder out.
Which is necessary at times. I've certainly sent people out.
Yeah.
But we always try to heal it up, and then if they do have that out, we always say that they need to do supplementation because of that. Mm-hmm. Otherwise, you're going to start to become deficient on all your fatty soluble vitamins.
Mm-hmm. Makes sense.
Schedule your appointment at the Prather practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather practice, restoring hope. Have you ever been curious about how acupuncture can benefit your health? The Prather practice has received the Indy A-List Award for Best in Acupuncture for 2 years in a row, and we've been rated the top acupuncture provider by Google+. Dr. Robert Prather is a board-certified licensed acupuncturist. He's earned a reputation for combining effective acupuncture-based techniques with cutting-edge technology to help patients with many conditions. Acupuncture is documented and proven to help with many health issues, including pain, allergies, addiction control, anxiety, fatigue, vision problems, infertility, and so much more. We even have needle-free options for those who are a bit squeamish around needles. Call the Prather practice to schedule your appointment and experience the benefits of acupuncture for yourself. 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, Restoring Hope.
And I'm feeling good. I'm feeling good.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest.
Well, we're talking today about iodine, the missing mineral in Indiana we talked about, but it really affects all of the Midwest.
All the Midwest, yes.
Yeah,
Indiana's a part of that, what we call the Goiter Belt.
So if the Great Lakes had some salt, that would have been good.
You're right.
In fact, I had someone say that, is there any salt in the... They asked if there was salt in the Great Lakes.
Yeah, not enough.
Well, we were talking about, one of your statistics that really hit me is you saying, people coming into your office,
right,
only 5% have a normal thyroid.
Have a normal functioning thyroid, yeah.
Wow, that's low.
It is very low, and the way that they interpret it, disease care, is that there's only about 10% of the people who have thyroid problems. But when you're looking at it in homeostasis, 95% of the people have abnormal functioning thyroids.
So let's talk about that. What is the difference between disease care and structure function care with reading blood work? And if we have a listener that's a new listener with our show, the Prather Practice, we practice structure function care.
Yeah, the FDA divides all care into two different categories. One, disease care model, which is based on pharmaceuticals and symptomatology, and then the structure function care, in which you're dealing with homeostasis. You're achieving homeostasis in the body. And homeostasis is health. Homeostasis is balance, and that homeostasis, if the body's able to achieve balance in homeostasis, then that is the definition of health. So really, we're health doctors. We improve the health of the individuals. We don't treat disease. And when you're interpreting blood work, those are two different ways of looking at it, which is a new paradigm for those who are in the disease care. They don't oftentimes understand. It takes a while to change their whole paradigm on the interpretation, because we're not looking, basically what they're looking for in the blood work is when you qualify for getting a pharmaceutical. What we're trying to do is to look for what we need to do to achieve a perfect health. And so two different types of models, two different types of ways of looking at it, and getting that model into people's brains is a new paradigm. And it's a new paradigm within the healthcare system. So that's where we approach our model from. I mean, that's one of the reasons I have the radio program. So we're trying to educate and get the word out there, because this is a new paradigm that is hard for people to understand.
Very important. And I know people that have been radio listeners for a while, understand that.
Right.
They've heard the word homeostasis. They've heard the word structure function care. But it is a new paradigm.
It is a new paradigm.
And you talk about how we need both the structure function care and the disease care model.
Correct. A perfect balance on that is 80% of the healthcare should be structure function based, 20% should be disease care model. Because we do refer out for pharmaceuticals, we refer out for surgeries. There are times where the body requires those. We're not against those things at all. It's just that we need a balance, and we need the two groups to work together. One of the things is that there's been a very much of a antagonism between the two groups, which there surely shouldn't be. When we find the best results in the healthcare system is when the two groups are actually working together for the good and the benefit of the patient.
Amen to that. Well, let's go on to iodine. Why do an iodine blood test?
Well, the iodine blood test is the most accurate way to check and see what the iodine levels are. And if you're talking about iodine levels, you want to make sure that you have adequate levels Otherwise, it can really cause some problems throughout the system. The highest concentration, of iodine is in the thyroid. So what most people think of is functioning of iodine for the thyroid. But iodine is involved in quite a few other different types of areas of the body. It's important for muscle development. It's important for proper organ function. It's important for the other endocrine system. For the brain is another area that it works. So iodine is first thought of as thyroid, but really it has a far-reaching effect on every single cell in the body. And every cell of the body is dependent on iodine to function properly.
So what role does iodine play on the effectiveness of the thyroid function?
Well, if you don't have the iodine in the body and at adequate levels, you can make as much thyroid hormones as you want, but they're not going to be effective because iodine is an important part of that. And if you don't have adequate levels of iodine, your thyroid hormones, which are absolutely important, we read all the things that affects.
Yeah, whole list.
You're going to start to see some of those symptoms. So, with that, the thyroid does not function without iodine.
And we did a thyroid show not too long ago, probably in the last month, that people can go back to,
Right.
with more specifics on the thyroid. And your story, because you had thyroid issues as a young man.
And that's why I got into this healthcare, this type of model, because this is where I really found the answers to my health and well-being was through the structure function means, and then was able to keep from the pharmaceuticals and the surgeries that were involved with the normal type of the disease process of taking care of my thyroid.
And you have now a normally functioning
I
thyroid.
now have a very normally functioning thyroid, which is great.
No goiter.
No goiter, no problems. And what I had wasn't really expected to be able to be treated naturally. That was quite a surprise.
So what are the effects of severe iodine deficiency?
Well, if you have severe iodine deficiency, the thing that actually shows up is something called creatinism.
Doesn't sound good.
No. So what happens is you have an impaired physical and mental development. And usually it's iodine deficiency in babies is the big thing that actually shows up. Because that's where iodine is very important in growth and in development. And if you don't have enough iodine, then that can actually cause a tremendous amount of problems. Matter of fact, the iodine levels in a mom, as she's carrying the baby, and in the first year or so in life, is going to determine the IQ of the child.
Wow.
Which shows up why we like to do iodine levels on pregnant women and on women who are breastfeeding. Because that is a very important indicator and very important for the development of the baby. So if you have severe iodine deficiency, you have permanent brain damage to the child where they are impaired and retarded. So retardation is one of the main things that happens if a child has severe iodine deficiency. Also, iodine goes into the muscle. And so you also have flabby muscles. You never have really muscle development. And then iodine is also important to bone development, so you have abnormally formed bones. So again, that has a huge problem. And they have a very slow metabolic rate and a very slow response time. So it's not something that you would want to see in someone. And that is severe iodine deficiency. But adequate, even where you have a little bit of deficiency, some of those things develop. So you don't have the muscle development, you don't have the skeletal development, you don't have the neurological development, they don't have a good endocrine system. So the whole system is actually underperforming. So making sure that iodine is present in the diet is absolutely essential to the proper development of a child, especially.
And you're talking about even when a woman's pregnant, or even before she gets pregnant, she should have it checked.
Oh, absolutely.
She's trying to get pregnant.
That is one of the things that is absolutely essential. One of the big emphasis is folic acid, which we had been pushing for quite a while for folic acid to be recognized as something that needed to be supplemented, especially in pregnant women, because that was one of the major reasons on why birth defects were occurring. But the same is true of iodine. Iodine has a huge effect on the mental and physical development of the child, and so keeping up with that is absolutely important, and can really make a big difference in how your child develops.
Okay, and we come back, more on iodine.
Listen to the Voice of Health radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
Hospitals have the most cutting-edge medical equipment, but they're still serving food like it's Shawshank Redemption. How about selling an MRI machine and getting a pasta station? There's different sections in hospitals. There's the emergency room, the intensive care unit, which sounds scary, but I don't know why anyone would want to stay anywhere but the intensive care unit. It kind of implies the rest of the hospital's like, look, we care, but we're not going to be a spaz about it. I get a phone call, I'm going to take it, right? We're like the mediocre care unit, which is better than we couldn't care less unit. Those guys are horrible.
Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather Practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather Practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather Practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather Practice by calling 317-848-8048 or learn more on our website at The Voice of Health.
We're talking today about iodine, the missing mineral in the Midwest. First, we were just going to title it The Missing Mineral in Indiana, but
Right.
as you were talking, really, it affects all of the Midwest.
Yeah, and as I said, Wisconsin has the lowest amount, and that's interestingly enough, Wisconsin is one of the fatter states in the country, and that's actually because of the low iodine levels. So iodine also is essential for weight loss. When we have people who come in for weight loss, one of the things we check on is iodine. And oftentimes they'll have extremely low iodine. And as we increase the iodine controls the basal metabolic rate, how fast you burn calories at rest. I don't recommend people just taking iodine. They should have a blood test and determine whether they need it or not.
Right.
That's one of the things that we really emphasize is not just go to a health food store and pick up vitamins willy-nilly because you don't know what you're doing.
Willy-nilly?
Yeah, willy-nilly. That's a technical term. And but iodine is essential for your basal metabolic rate was one thing that I talked about. And that determines how much you weigh. So that's one of the reasons that the Midwest has a higher weight.
Body fat percentage.
Has a higher obesity rate is because of the low iodine that we have here.
Well, I know some people come in that want to lose weight. You check their blood work,
Right.
and you need to get the thyroid balanced before that
Thyroid,
can happen.
iodine levels, liver. There's so many different types of aspects that are important. And there are many times that we just correct that and all of a sudden they start losing weight without even trying.
Right.
So physiology, again, is very, very critical.
Well, at our last segment, you talked about the importance of iodine and babies. So what effects does non-optimal iodine have on babies? You talked a little bit about that.
You have poor development. One of the big things is that there are different levels of iodine in all the different organ systems of the body, and each one of those can be very critical along those lines. But the biggest things on your child is their intelligence level. Mm-hmm. Iodine is very much associated with that, and the higher the iodine levels on an optimal type of a basis, the higher the intelligence of the child. So really looking at that is a very critical type of thing. And one of the things that they find is that the areas of higher iodine, there is a higher IQ usually.
Interesting. So we just need to make more visits to the ocean.
Yeah, there you go.
And eat more fish.
Right.
And that's kind of a problem here too.
Yeah, getting fresh seafood.
Fresh seafood, yeah,
right,
very important. Well, what distribution does iodine have in the body?
Well, there's about 20 to 50 milligrams of iodine in the body. 50% of the iodine is in the muscles. That we talked about muscle development. Mm-hmm. One of the things, if there's a severe iodine deficiency, then you start to have flabby muscles. So if you're, one of the things is we had a boxer who came in, and one of the things he was...
Not the dog, right?
No. He was a professional athlete. Uh-huh. And one of the things we did was we found low iodine, started him on the iodine in his muscle. He said, all of a sudden my muscles are popping up. So for those gentlemen who are trying to get strong muscles...
Or women.
Mm-hmm. And they don't want flabby muscles, iodine is absolutely essential. Mm-hmm. So, what you do is you find out what the deficiency kind of seems to cause, flabby muscles, keep the iodine levels up, and then you actually have good toned muscles. Mm-hmm. It makes a very big difference about that. But 50% of the total iodine in the body is distributed among the muscles. 20% of all the iodine is in the thyroid of the body. But the concentration, because it's a very small area, is 1,000 times greater in the thyroid than in the muscles.
Because it's more concentrated
more
in a
concentrated,
small area.
Very small area.
Interesting, because I've always just thought iodine, thyroid.
Right.
Not realizing you said 50% in the muscle.
50% of the muscle, is actually in the muscles, and it's important for the muscles to be able to work properly and to develop if you have enough iodine in there. 10% is in the skin. Healthy skin is important for iodine. Mm-hmm. If you have low iodine, that can actually kick off acne and other different types of skin problems, because the iodine is very important for that to be able to function properly. Mm. So iodine in the skin, 10%, 7% in the skeletal structure. So that if you don't have proper iodine, then you can't develop your the skeletal structure. So it can be involved in osteoporosis, especially in growth in children. To have that development of what's called the osteoclasts, which actually make the bone, is very, very those cells that make bone are very dependent upon iodine to be able to do that.
Interesting.
So that could be a big reason for osteoporosis, also for any type of skeletal malformations. Very important that you have your iodine levels. And then 13% in the other endocrine glands and also in the brain. And very, very important for the testes, ovaries, adrenals, and then for the central nervous system to function properly. As we said, iodine has a huge importance on the development of the brain, and if you actually are low on that, then that really cuts down on brain development.
Interesting. So it's distributed throughout the body.
It's distributed and very important for all of these different types of systems to work properly.
Okay. So where do we get iodine from? What are the sources we can get iodine from?
Well, the sea is where the majority of all the iodine in the world is located. And we talked about if it's in the soil, it's because the land was underneath the sea at one point and got a lot of iodine, which makes it more productive. So that is a very important part. So what we get iodine from is things from the sea. So if you're going to eat anything, fish from the ocean, kelp, salt, are all good sources of
The sea
iodine.
salt. Mm-hmm.
Sea salt. Air, actually, if you're in the air by the sea, you actually absorb iodine right through the skin. It's actually a good source to actually get it. That's why you feel refreshed going to the sea. So all of a sudden you're absorbing a lot of iodine.
That's why Midwest people like to go right to the sea. And
yes, there's a very strong type of a pull along those lines.
yeah, a need.
Right.
Interesting. So what can interfere with iodine being used?
Well, you have to have proper levels of zinc. Zinc to be able to, for iodine to be utilized and absorbed, if you're low on zinc, even though you're putting iodine into the system, you're not going to actually be able to utilize it. Also, a properly functioning liver. So you can have all the iodine that you need, but if your liver's not working up to par, because the liver converts the iodine into iodide, which is the usable form. So liver function is also important. So zinc and liver are absolutely critical along those lines.
Yeah, that zinc keeps coming up.
Zinc is sort of like a precursor. Oftentimes we find that people, whenever we give them zinc, so many different types of things start working, and zinc is more of a facilitator for all these different types of things to work.
Interesting.
Yeah.
Yeah, because I see zinc going out in our office.
Yes.
A lot.
Yes.
So what steps can be taken to ensure proper iodine consumption?
Well, the federal government and the health bodies here in the United States said, hey, we've got a real problem. With this Goiter Belt and the iodine deficiency. So what they did is they started adding iodine to salt.
Oh, okay. When was that?
That was back in the 1920s and 30s.
Okay.
They saw this really big need, and people had been getting the way that you used to get salt is they used to get it from the ocean. And then they started what was called commercial salt, where they actually mined it and were able to sell it a lot cheaper, because salt used to be pretty expensive.
Yeah.
If you ever heard of, the man's, he's worth his salt.
Yes.
Well, what they used to do is pay the Roman soldiers in salt. And it was from the sea, and so it actually had a lot of value. So salt used to be pretty expensive, but it had lots of iodine. Then when they were able to start mining salt and get it cheaper, it didn't have the iodine in it.
When they mined it.
And so all of a sudden they developed this whole huge problem here, especially in the Midwest, where people were developing goiters. And so they said, we need to do something about this. So they started to put iodine into the salt to help to make up for it. And then they also added it to bread, was the other thing. So they have decided, because of such the high need and the huge impact on the health and well-being of people, they started to add iodine into foods that people normally consume to try to keep their iodine levels up. Otherwise, it was just such a huge health crisis that was causing problems throughout the whole, especially in the Midwest.
Interesting. And now people avoid that salt. We recommend sea salt, correct?
Right. Which has iodine in it. But people who do avoid it, or all of a sudden decide to have a low salt type of diet, are oftentimes now, especially in the Midwest, deficient in iodine, which starts to cause other different types of problems.
So very important to get it checked.
Very important to get it checked and make sure that, and the federal government obviously knows how important that is. That's why they used to add it in.
Okay. When we come back, more on iodine.
Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice.
Homeostasis is balance, and homeostasis is health. So the better you are into homeostasis, the healthier you are. And structure function care is about making you healthier by bringing about homeostasis in the system. Oftentimes, parents will say, well, I don't really need to get my kids checked out. Kids are just naturally healthy. That's not actually true. Kids are greater risk than adults are for many things. So getting your kids checked and making sure that they're in homeostasis is one of the most important things.
Yeah, and don't wait till they verbalize.
Right. Kids don't know, you know, so having regular checks, making sure, and pediatricians are fine, but they're dealing with disease care. They're not really working or trained in providing homeostasis for your child. So finding someone who works with homeostasis, especially in children, really helps them throughout their entire life, and something that should be established at a very young age. Children's immune system is based off of the thymus. Just to kind of simplify it, it's much more complicated than that. Whereas adults, we have a bone marrow-based immune system.
Oh, that's really interesting.
A thymus for a child is about 4 times bigger than adults.
Oh.
Because it actually works. Once they reach puberty and they've reached their maximum growth, the thymus will actually shrink. We really look towards the thymus, work with it differently. So even the different types of products that we would give for a child as opposed to adult, there is a definite difference on that to boost the immune system.
Are there ways to support the thymus? How do you do that?
There are ways to support the thymus. There are several different herbs that can be involved, homeopathics. But one of the best things that we give is something called thymus glandulars. We give them all the necessary nutrients to build their thymus. But children, it's extremely effective and can really, really boost the immune system, because that really has a big effect, especially on any type of viral infections.
So what can damage the thymus?
Now, thymus is very sensitive. One of the things that they found is that vaccinations damage the thymus. They've done pre and post studies on the thymus. About 80% of the time after a vaccination, there's a shrinking of the thymus. Now, we're not completely sure, but any type of stressors on the system. Heavy metals also will shrink the thymus, so mercury, aluminum, lead. So making sure that you support the thymus, keep the toxicity as low as possible in the child, really helps out with the immune system, because there's a very strong correlation between the size of the thymus and its effectiveness.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
It's a beautiful day. Sky falls, you feel like it's a beautiful day. So let it get away.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients.
Well, we're talking today about iodine, the missing mineral in the Midwest. And it's very interesting, Dr. Prather, I just think of iodine and thyroid issues, but so much more.
Well, yes, it is. And it's absolutely essential for thyroid function, but it's also very essential for a lot of other different aspects of the body. But definitely very devastating if you don't have enough iodine for the thyroid.
So what are the minimum requirements of iodine?
For infants, it's about 4 micrograms. For 6 months to a year, it goes up to 50 micrograms. So there's really a huge jump there, especially during that 6 months to a year. For children 1 to 3 years old, it's 70 micrograms, 4 to 6, 90 micrograms, 7 to 10, 120 micrograms, 11 up to adult, 150 micrograms. Now, pregnant women should have at least 175 micrograms, and lactating women should be taking 200 micrograms.
Even more. Okay.
Yeah. Now, this is just to keep from getting goiter. Okay, this is the very basic minimal, not for optimal.
Okay. And as we were talking, I remember my parents putting iodine, if I fell and had a cut,
Right.
they would put the iodine on my skin.
Right. Now, one of the interesting things is that iodine also is an antiseptic. So it kills bacteria, viruses,
That's why
and
they did it.
fungals. Right. And also, as you take it internally, it also keeps infections down. And iodine is the main thing that keeps infections from getting into your thyroid. Because if you have low iodine, then infections can hit the thyroid, and oftentimes the theory is that it kicks off the autoimmune Hashimoto's or Graves' disease.
Oh, interesting.
So low iodine also makes you more susceptible to infections, and especially infections and autoimmune reactions within the thyroid.
And people don't do that anymore, do they? Put the iodine on the skin?
Not as much,
I
but
can smell it even. I remember the smell,
Right.
and it was kind of, it stained your skin.
Yes.
I remember.
And then it's actually one of the interesting things is if you are low on iodine and you put iodine on the skin, how quickly it disappears is a sign of how much you need it. So it's a good thing if it stays stained for a little while.
Yeah. That was interesting. That just brought up that memory. But can iodine become toxic?
One of the interesting things is that they have found that there's very little toxicity with iodine. So they have found that even 10 times the RDA they haven't found any toxicity that's associated with it. Now, you do have to be careful of the acne, because if you do get too much iodine, remember that if you are too low on iodine, that can kick off acne.
Yes.
But if you get too much of it, if you already have acne, it can make it worse.
Okay.
So that would be one thing that you have to be careful of. One of the things is that the body doesn't really store iodine. So there's not really a storage, so there's not really a backup if you get too low. And iodine is usually excreted through the kidneys if you get too much. That's the area that goes through. So having proper kidney function is an important part of getting rid of any type of excess iodine.
Interesting. So what effect does iodine play in female hormone balance?
That is really the big area that is oftentimes missed. Low iodine kicks up what's called hyperestrogenism. Okay? And hyperestrogenism is what really causes a lot of the symptoms in females and also makes it much more susceptible to getting cancers that are associated with that. So many of the different types of issues that women have with PMS, mood swings, all those different types of things are associated with hyperestrogenism. And one of the main things that causes hyperestrogenism is low iodine. Also, interestingly enough, when you're talking about estrogen, is that there are different kinds. There's estrone, estradiol, and estriol.
That's a lot of S.
Yes, and those are all different types of estrogens. And there is what we would consider good estrogens and bad estrogens. And iodine is critical to convert the estrogens that aren't good for you, that cause a lot of the problems, causes a lot of the shifts, causes cancer, into the good estrogen, which is estriol. So very, very important for women to be able to have proper iodine levels. Also, iodine keeps men from taking testosterone and converting it into the bad estrogens too. So the balance of the hormones is not only very important for iodine's not just important for the thyroid, for their hormones,
Right.
but also for the sex hormones in males and females.
Interesting. Wow. It has a lot of effect.
A lot of effect. Yeah,
That's why that blood work is so important.
and that's also why iodine is very important. I mean, when you're talking about some of the effects that low iodine, if you have proper levels of iodine, you have shorter menstrual periods. You have decreased menstrual flow. You have decreased PMS symptoms and mood swings. It also is absolutely essential for fibrocystic breast disease. And iodine is the cure for fibrocystic breast disease. They have done studies on women who were suffering from that, from painful breasts and fibrocystic disease of the breast. 95% cure rate with proper levels of iodine. So iodine is the key to that, to actually get that fixed. And the fibrocystic breast disease is what is the first indicator of leading to breast cancer. So iodine is a very, very important preventative along those lines. Fibroids. Iodine levels has a direct effect on the fibroids in the body. It really has a huge effect on just how the endometriosis, all those different types of things are oftentimes cured with iodine levels.
Interesting. So you talked a little bit about cancer. What effect does iodine have in cancer?
It is very important for prevention of breast cancer, uterine cancer, ovarian, and endometrial cancer. They have found that people groups who have higher iodine levels have far fewer of those, and keeping the iodine levels is actually a preventative for each one of those cancers, and also for prostate cancer in men. So all the sexual cancers, that are associated with the sexual organs, iodine has a huge effect on that and really helps to prevent each one of those.
Important. So what role does iodine play in the immune system?
The immune system is very, very dependent upon iodine. One, iodine has a direct effect on viruses, bacteria, and fungals in the body. So if you keep your iodine levels, that just like on topically, it also kills them internally too. But as I said, on the immune system, one of the biggest things is especially protecting the thyroid, because the thyroid is a very active type of area rich in a lot of nutrients. It's a very big target for a lot of different types of infections. And if you can keep your iodine levels up, iodine is the main immune factor that keeps the thyroid clear from infections, which kicks off the autoimmune diseases.
Interesting.
So the immunity of the body is very, very dependent upon iodine, and it is essential to especially the activity, because iodine increases the metabolic rate, and the metabolic rate is how fast the white blood cells move.
Okay, we have a few seconds here. Dr. Prather, how would you like to conclude?
I really think that everybody, especially here in the Midwest, should have their blood test for iodine.
And we offer that with the Prather profile. The iodine is in there along with vitamin D, and it checks every organ system in the body. So
Yes.
important test to get. Well, thank you, Dr. Prather, as always. Very informative.
Thank you, Lisa.
The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.